Dear Dr. İnceoğlu, thank you for your time for your interview. Can you introduce yourself, please?
Hi, I'm Dr. Serol İnceoğlu from Istanbul, Turkey. I've been working as a plastic surgeon for almost 30 years. I worked on very different aspects of plastic surgery, from trauma to congenital problems to aesthetics and microsurgery. And at this stage of my career, my main focus is now on the facial and the body aesthetic surgery.
And what is the problem with the BBL surgeries? What's your opinion about them? Why there are so many complications?
Yeah, BBL surgery is, as you know, done to augment the buttocks by filling them with fat. Of course, it's a very practical solution and it has been successful in many hands. But still, it has some problems, and especially when it is done by unqualified doctors and when it is done in inappropriate patients, there may be some serious health problems. So this is now a very popular but also a risky procedure for several reasons.
You have a unique concept for this problem. Can you explain this new concept, this new patented concept to us, please?
Well, first of all, as I said, at this stage of my career, after I learned a lot from my mentors, teachers, and my patients, and after many good results and also failures, I've come to realize what is the best way of doing plastic surgery in general. So I call this new approach of mine as Renaissance Finesse, which means doing the operations with the understanding of the anatomy of the particular patient and trying to obtain the best possible results. And meanwhile, trying not to put the patients in hazards of very difficult operations. I mean, the duration of the operation, the amount of the fat used, I mean suctioned and filled, they're of course very important factors in deciding the outcome. This new approach relies on pure anatomical facts. For example, in a patient who has lost considerable weight, there is sagging and fat accumulation in certain parts of the waist and the buttocks. This particular patient would like to have a thinner waist and a more prominent gluteal region, the buttocks, I mean. In my approach, I try to create a new waist and buttocks, in fact, a new torso, by using the tissues of the patient, but doing this with classical surgical maneuvers. So this is in this operation, I don't use large amounts of liposuction or any amount of lipofilling.
I see. And what is the pros and cons of this surgery concept when comparing with classical technique?
Okay, first of all, we must understand that my approach is suitable for the patients who have real excess tissue in the lower back and the gluteal region. So, from the start, we must say that any particular patient who doesn't have this excess tissue, who has a thin waist but still wants to have larger buttocks, then, lipofilling is still the first choice. But I know many patients, especially who have these weight problems, need both waist thinning and gluteal lifting and augmenting. So when we do this operation, we have a very durable and long-lasting reconstruction around the waist, the lower back, and the gluteal area.
I see. I wish you thank you for your time. It was very clarifying this new concept. Thank you for your time and this great explanation.
Well, thank you for giving me the chance to enlighten my patients.